they don't have the iron because the baby is taking it that third trimester and making its own hemoglobin, then their oxygen saturation will come down on our end and their resting heart rate will go up. Because what we know about the body is that if the oxygen demand is not being met, the heart rate's going to go up, because it's like you're trying to use what you have and deliver it to all the muscles needed. So that process has to be done faster if enough oxygen is not readily available. So for this particular mom, her hemoglobin went from 12 to 8. So if you've worked in a hospital system, you understand at 8, nobody's giving you a blood transfusion. Nobody's doing anything. They're looking at that like, oh, she's just on the lower side. She just had a baby. Well, for this particular mom, her resting heart rate stayed up at about 120. So we know we're looking at 60 to 100 as normal, but during pregnancy, the resting heart rate will go up a little bit. So if a mom starts at 60 on our system, typically she'll get to like 75. If she starts at 80, she'll typically get to about 95. You should not be resting at 120 into your heart rate. So this is what her resting heart rate was. Nobody went in to see her in the hospital. I told her, you should really stay. I know that you're at 8, but something's not right. She was ready to go home. Doctors were ready to discharge her. So she left. The next day, resting heart rate kept going up. And so by that second day, I called her husband and I was like, look, she's not going to be happy with you, but she needs to go home. I cannot watch this on the dashboard and know that women are going into heart failure and having to be readmitted that first week or dying within that first week because this stuff is missed. So he took her to a med stop. They did an EKG. They immediately sent her to the hospital. They did an echo. Cardiologist was brought on board. She was given a beta blocker to help with her heart rate. He said that there was fluid around her lungs and that she had 3 weeks. He would have given her 3 weeks before her heart was completely taken over.